It's our real pleasure to have Dr. Neil Binkley with us today. He's a professor of medicine in the Division of Geriatrics and Gerontology at University of Wisconsin in Madison. That's where he trained for medical school and did his training in residency and in fellowship. He did his residency in Marshfield at the Marshfield Clinic and did his fellowship at the VA through the GREC, Geriatrics Research Education and Clinical Center in Madison, and then did a postdoc in aging in geriatrics at the University of Wisconsin-Madison Institute on Aging. And he's very well known, a world leader in osteoporosis. His interests include nutrition and vitamin D and osteoporosis and muscle, bone, and fracture risk, along with diet. So he's really been a really productive researcher, done some of the leading studies on investigational new drugs. He's published more than 300 scientific papers and another 350 or so book chapters and other publications. Very prolific, been very well funded. And today he's going to talk to us about a title that sounds very intriguing, Opportunistic Imaging in Osteoporosis. So Dr. Binkley, welcome, and thank you so much for joining us today.
Well, thank you for inviting me to speak with you today. And I was initially contacted to talk about opportunistic imaging in osteoporosis, and I expected that we were talking about opportunistic CT, which I think, and I'll share with you, I think it's just been an incredible advance, at least from my personal perspective, as far as my own clinical care. But I then elected to branch this out into further other areas of imaging. And I'm going to spin this primarily toward direct clinical applicability today. And at the end, I'll talk about a couple things that I think are more research appropriate. These are my disclosures. I think probably the most important disclosure in our evidence-based world is that at least some of this is going to be my opinion. And rather than saying this is my opinion every time I would have to say that, I denote that by coloring the font or the text orange, as you see here. So very briefly, where are we going this morning? I'd like to consider the clinician opportunistic review of the following to optimize our patient care. And so we're going to back up and start with DEXA, VFA, and CT for bone. And those three are, the first two are obviously clinical real world, and CT for bone, I believe, as well. And then briefly talk about CT for muscle and opportunistic MRI.